Well, Dr. Dana, good morning.
Good morning. How are you, Gina and Mike?
Excellent.
Good morning. Thank you.
Excellent.
Great.
Fantastic show up till now.
Oh, what?
Well,
You're going to carry us through.
Now,
Come on, get us
now
through
it
to
gets
the break.
better.
Well, I thought that we should talk about something that's real relevant to this time of year, what I call the other sore throat. As you know, we all get sore throats and cold symptoms and so forth this time of year, but those will get better on their own. But I thought we should talk a little bit about the one that needs to be cared for and treated, and that's the strep throat.
Oh, yeah.
A lot of parents are confronted this time of year with the child coming in and saying, my throat hurts. Strep throat is not a virus. It's caused by a bacteria called Group A strep. And this infection increases during mid to late winter and during our early spring months. And because of its potential for serious complications, we all, as parents especially, need to know the signs and symptoms to look for.
Yeah.
These increased cases occur sometimes until school gets out and the kids get away from each other. We spread this bacteria by airborne droplets, sharing food and drinks, and even contaminating our hands from solid surfaces and then touching nose and throat. So this is something that, sign and symptoms-wise, we just need to be aware of, looking for that sore throat that doesn't have cold symptoms, the sore throat that has those enlarged, painful lymph nodes that we all dread, and looking in our children's or even our own throats and seeing those tonsillar patches of pus and so forth. Ultimately, if you see the rash developing, especially down in the groin area, that's a sandpapery type rash. We call that scarlatina rash. That's the ultimate thing that should take you in to see your doctor.
Okay.
Difficulty swallowing, where you can't even swallow your own saliva, swelling and painful joints, and shortness of breath. These are very ominous signs that definitely should take you in to be seen. But occasionally parents really get fooled because the only thing the child complains of is an occasional episode of vomiting.
Now it's treated, Dr. Dana. Dr. Dana, the treatment for it is a rather simple one, yes?
Yes, it's an easy disease or infection to not only diagnose but to treat. Diagnosis is simply by physical exam, history taking, looking for risk factors, and then rapid strep tests in the office, which only take a few minutes, which are about 70% accurate, to doing a full culture. But the treatment, again, as you said, simply penicillin, amoxicillin. For those that may be allergic to the penicillins, you can certainly use Zithromax or erythromycin. Mm-hmm. But the important message here is that parents need to, when their child is diagnosed with strep infection, they need to be looking for that Coke-colored, and actually looks like Coca-Cola colored urine occurring a week or more after the infection, and then also that shortness of breath and joint pain, because as we know that this is the same bacteria that can lead to rheumatic fever and heart valve damage.
Right.
The cola urine indicates kidney inflammation, which is called post-streptococcal glomerulonephritis. But this, again, we're going to be heading into the season, and our school-age children, especially at ages 5 to 15, are highly at risk and need to be watched closely.
Yeah, you're so right about that. And I also know some kids can be carriers of strep, but not actually present symptoms of strep.
Actually, that's exactly right. About 12% of our kids can be carriers. They do not have symptoms. They do not need to be treated, and they're simply a carrier, and that's about 12%. The rest of them, where it's diagnosed or sick, obviously they need to be treated. Parents need to make sure that their children rest after they have this infection diagnosed, because they need to not be exposed to other infections, which they can get. The great mimic of this infection is that sometimes kids can have infectious mononucleosis, which may look exactly the same, but these are the kids who don't get better 48 to 72 hours after treatment. You need to recontact your physician because the diagnosis may indeed change.
Okay.
Or you can have those two infections even concurrently, which is a real problem.
Well, we have been blessed to not have seen strep throat in our house so far this year, but we've had other things. But we appreciate you educating us again on this another great topic for families. And
as always.
Yep, absolutely. And we thank you for joining us again on the roundtable.
Okay, and I'll look forward in the future of talking about that discussion you had early on with the content of our kids' television and movies.
Yes, indeed.
Oh, yeah.
Dr. Dana, we will speak next Saturday.
Thank you.
Thank you.
Take care. Have a great week.
Thanks.
Thanks.
Bye.